From the start of the pandemic, there were predictions of a baby boom, with many couples stuck at home and little else to do. But as it turns out, in some cases, the pandemic and economic struggles have led some Americans to hold off on family planning. Naomi Ruckham explains why the country is experiencing a baby boom and a baby bust all at the same time.
When the pandemic hit, Jen Surma and her husband thought about waiting to expand their family.
I think it was just really the unknowns of COVID at the time that had us kind of take a pause and think about if this was the right thing to do.
But wanting their children to be close in age, they decided to try and got pregnant with baby number 2.
It's been good from kind of has slowed life down and made it a little bit more comfortable.
Jen is part of what some hospitals in the U.S. are seeing as a baby boom, including Community Hospital North in Indianapolis, where deliveries are up 30% compared to this time last year and are expected to spike to 70% by March.
I think on one shift I delivered 8 babies in a day, so it was a busy day, but it's kind of great.
Hospitals in Kentucky, Tennessee, and Illinois have also reported more births. And while pockets of the country are seeing many more bumps like mine, analysts predict nationwide the pandemic is more likely to cause a baby bust.
It's a stressful time that we live in. Stress is not great for thinking like, gee, I'd like to have a baby right now.
In an estimate published by the Brookings Institute, economics professor Philip Levine predicts the pandemic will result in 300,000 fewer births.
There's issues with daycare, school closings, relationship formation.
For Jen, a pandemic pregnancy has been anything but ordinary.
It's kind of hit me more recently that it's just going to be a really interesting story to tell him.
And now that he's arrived, it's one for the history books this growing family won't soon forget. Naomi Ruckham, CBS News.
The birth rate in the U.S. was on the decline before the pandemic, and if the trend continues, some experts worry this could lead to a shrinking workforce and economy. A new study is shedding light on the risk for depression among younger teenagers. Researchers looked at over 11,000 11-year-olds in the UK. They found boys who played video games most days had 24% fewer depression symptoms by age 14 than those who rarely played. This effect was more significant among boys who were not physically active. But girls who used social media most days had 13% more depressive symptoms at age 14 than infrequent users. A new study reveals a racial gap when it comes to flu vaccination rates among older Americans. Researchers looked at medical records from over 26 million Medicare patients during the 2015-16 flu season. They found Hispanic, Black, and Asian Americans were much less likely to get a flu vaccine than whites. And among those who did get the vaccine, racial minorities were about 30% less likely to receive the high-dose version, which is more effective in older people. Experts say these findings could reflect future gaps for COVID vaccinations.